I must have taken a wrong turn. I do not recognize this place. Where am I?
This is certainly not my house. Oh no, I think I'm lost. I better call Johnny to come get me.
Dr. Alois Alzheimer of southern Germany examined the brain tissue of a woman who had died of an unusual mental illness back in 1906. This woman had displayed symptoms of memory loss, language problems, and unpredictable behavior. On autopsy, he found many abnormal clumps and tangled bundles of fibers in her brain. Today, these abnormal clumps are called amyloid plaques, while the tangled bundle of fibers are called tau or neurofibrillary tangles.
Can you tell me what brings you into my clinic today?
You don't look like a doctor, and there certainly is nothing wrong with me.
Where is the way to the lobby? Is it left or right? I need to find my son and get out of here. Oh no. Not you again.
Now, Mrs. Anderson, I will need you to come with us to get a head CT scan done, so we can better be able to help you.
In a clinical trial done with 34 patients and 20 controls, George et al. Found on CT scan imaging mild to severe temporal lobe atrophy and a characteristic hippocampal lucency in 80 to 82% of patients suspected to have Alzheimer's. Dr. Daniels, go ahead and present your findings on Mrs. Anderson's case at this time. You may start screen sharing.
Thanks, Professor. 68-year-old Mrs. Anderson was brought to the clinic yesterday by her son with complaints of progressive memory lapses, such as losing her keys and getting lost in familiar places, of 6 months' duration. On examination, she had a blank expression with prominent deficits in short-term memory, word finding and executive functions. Her judgment was somewhat impaired. Her lab work revealed a 50% reduction in AB42, or amyloid beta peptide 42, as well as p-tau, or phosphorylated tau, and total tau or t-tau proteins in her CSF analysis. Before you is a CT scan image of her brain. Arrows here depict signs of bilateral temporal lobe atrophy and hippocampal lucency, more pronounced on the right compared to the left.
Thank you. Now, does anyone have any questions for Dr. Daniels? If not, I will ask a biochemistry-related question. This is directed at all of the interns present. Which biochemical mechanism is likely involved in the pathogenesis of this disease? Which of these mechanisms characteristically occurs in Alzheimer's disease?
I would say A.
Thank you, Dr. Davis. Do you mind explaining to us why you chose A?